Hey guys, it's Louis here from ndxtesting.com, and in today's video we're going to speak about the implications of mouth breathing. Now please listen. If you have anxiety, high blood pressure, insomnia, a rapid heart rate, perhaps you have trouble sleeping, maybe you're developing severe insomnia, or maybe the early stages of sleep apnea, heart disease, cardiovascular disease, and other implications when it comes to your health, it's extremely important that you listen to what I'm going to say in this video, because it can literally change your life. Now, it's important for you to know that mouth breathing, okay, breathing through your mouth, it's a silent epidemic that is affecting the lives of millions of people. Now, the truth of the matter is a lot of people are not even aware that they're mouth breathing, especially when it comes to their sleep. Now, I had developed high blood pressure, anxiety, and at the peak I developed insomnia, a rapid heart rate, and nobody knew, not a single doctor knew where the root cause of this situation was coming from. And I was able to diagnose myself, and I was able to understand that throughout the years, with me not even being aware of it, I was actually mouth breathing through perhaps all my life. Now, when you do that, it could definitely implicate your health. Now, what happens is that when we breathe, right, we need to breathe through our nose. Our nose it's the main passage when it comes to breathing. Now, when we breathe, right, we need a scientific molecule that develops within our body called nitric oxide. Now, what nitric oxide does to our bodies and to our arteries, it widens the blood vessels, and blood will be able to flow thoroughly. And your cardiovascular system, composed of arteries and veins, your peripheral nervous system, composed of nerves and muscles, your brain, your cells, needs nitric oxide. Without this scientific molecule, your body will break down. You will not be able to function properly, and over time it will narrow your blood vessels, and you can develop diseases like high blood pressure, anxiety, insomnia, cardiovascular disease, and many others. And then you're going to go to your doctor, and he's not going to know why you have these symptoms. So what we're going to do in about a minute or two, we're going to go to my screen, and I'm going to share my screen with you guys, and I'm going to show you guys some notes and some websites that teaches you about the implications of mouth breathing. But it's important for you to be able to understand this, because especially when you sleep at night, if you're breathing through your mouth all night long, unaware and not conscious as far as what's going on with you, you could develop drastic symptoms when it comes to your health, and you're not going to know where it's coming from. So it's important for you to understand that we need to breathe through our nose only. And you might be looking at this video, watching this video now, it's like, well, I breathe through my nose, but you won't be able to know for sure. And at the end of this video, I'm going to show you how exactly to find out if you are actually breathing thoroughly in your sleep. Let's go to my screen. Okay guys, so I came to this website here called Precision Health. They're pretty good educational website when it comes to mouth breathing. Look at the young lady on the website. That's definitely a way that you do not want to sleep, because she's breathing through her mouth, and eventually it will get her sick. She needs to be breathing through her nose, and that mouth needs to be closed. Now it reads here, the impact of mouth breathing. Okay, so let's read here. So mouth breathing can impact your health. If you never thought about it, you're not alone. Most people, even some healthcare professionals, are not aware of how important proper nasal respiration is. Your nose is the first line of defense for your respiratory system. It filters and humidifies the air you breathe. People that breathe through their mouth may face negative health effects. We're going to learn about a few here in a minute. Okay, so what causes someone to breathe through their mouth? Well, mouth breathing can be attributed to many things. It can be caused by stress, anxiety, by the shape of one's nose or jaw, congestion brought by allergies or illness, enlarged tonsils, nasal polyps, adenoids, or simply feeling out of breath. And one thing that we're going to learn about too is when you start breathing through your mouth at early age and you develop this bad habit, you can develop an overbite. And then if you have an overbite, that's going to cause you to open your mouth and breathe through your mouth when you sleep. Now, why is mouth breathing bad? Now it says here, nasal respiration is essential because it produces nitric oxide. Remember at the beginning of the video, I was talking about nitric oxide, and it's important that you learn about this because it can literally change your life and the way you see things, the way you look at your health, and the way you look at how to take care of your body. So now it reads here, nitric oxide increases oxygen efficiency, blood oxygen, and arterial oxygen tension. Dr. Heidi Dickerson points out that the lack of nitric oxide that is produced in your system is linked to many issues such as heart disease and Alzheimer's disease. Nasal breathing and even breathing techniques such as humming increases nitric oxide production, and that's really, really important. Your nose was specially designed to help you breathe and therefore has many advantages. When you breathe through your mouth, however, your lungs do not receive all the benefits. Mouth breathing causes bad breath, poor sleep, early aging, gum disease, and high blood pressure, and many other diseases that we're going to learn later on. So according to Healthline, mouth breathing can lead to crooked teeth, facial deformities. A lot of people don't even know about that, or poor growth in children. Once you get into the habit of mouth breathing, it can be very difficult to stop. An intervention might be required. So the sooner you learn about this, the sooner you can change. And one of the best advices that you can give your young kids is to breathe through their nose. I know I tell my kids all the time, breathe through your nose, not through their mouth, because if they breathe through your mouth, they're going to get sick. So what we're going to do, we're going to take a look at my screen here, my personal notes, and we're going to look at some stuff here that I wrote here. Okay, mouth breathing increases your blood pressure. Right, so when you breathe through your mouth, right, you bypass the natural filtration system provided by the nose. The nose acts as a humidifier. It filters and it regulates the air that you breathe. It removes dust and allergens, and it releases nitric oxide, which helps widen the blood vessels and improve oxygen uptake in the lungs. Mouth breathing, however, bypasses these functions, leading to reduced oxygen intake and potentially affecting your health. And it's extremely important that you know this, because the difference that your body can have from mouth breathing and nose breathing is huge. Now, it says here, breathing through the mouth can cause dryness in the mouth and throat, which will increase the risk of dental problems and higher chance of developing throat infections. Continuous mouth breathing can lead to dental decay, bad breath, gum disease, and other oral health issues. Chronic mouth breathing leads to anxiety, high blood pressure, insomnia, sleep apnea, and a rapid heart rate. And people have no idea, and they're taking medications. The medication is going to help fight the symptoms, but then you got the root cause causing the symptoms, and who do you think is going to win? The medication fighting the symptoms, or the root cause causing the symptoms? Don't know. That's why a lot of people sometimes are changing medications, and sometimes the medications do not work. So it's important for you to find out the root cause of the problems, and then you could take some medications. Now, chronic mouth breathing, right, especially during childhood, can impact the development of the face and dental structures. It can lead to misalignment of teeth, crowded or crooked teeth, and it changes the shape of the palate. If the palate changes, then your face is going to change. You can develop an overbite. And that's why sometimes people look the way they do. They have no idea that the bite, having a perfect bite, is the foundation of your face. Now, it says here, including, let's go to sleep disturbances. Mouth breathing is often associated with sleep disturbances such as snoring and sleep apnea. Now, it's important for you to know that snoring means that you're struggling to breathe. Now, you can snore sometimes. Maybe you're tired, maybe you have a couple of drinks, but snoring constantly means that you're struggling to breathe. and that's not good. And most of the time, if you're snoring, that means you have your mouth open. You can still snore through your nose because you can have a deviated septum. You can have a couple of implications. But if that's the case, then you need to see a healthcare professional to find out. Now, when you breathe through your mouth while sleeping, it can disrupt the airflow, leading to snoring and disruption of actually breathing. Now, what happens is sometimes you snore, right? And then when it gets advanced, you can stop breathing because your airways close, and then sometimes you wake up and sometimes you doesn't. That's what actually sleep apnea means, that you breathe, right, and you're struggling to breathe, and all of a sudden you stop breathing, and that can't happen. That can really compromise your cardiovascular system within time. It's sleep related. Now, just the end here, these sleep-related issues can result in daytime fatigue, impaired cognitive function, and other health problems. So at last year I wrote, if you know someone that breathes through their mouth, it may be beneficial for you to consult a healthcare professional. And the ENT doctor, which I had visited years ago, an ENT doctor will definitely look at your throat and nose and see if you have any breathing obstructions. And if you do, then they can take care of it, and then it can educate you a little bit about what you need to do. Okay, and then you have an orthodontist. An orthodontist will definitely look and see if you have an overbite, if you have some bite issues, and they can fix your bite. And when your bite is perfect, then you'll be able to breathe accordingly. And a dentist, of course, will be able to look at your throat. Will be able to look at some dental work. Will be able to provide and tell you if you need an orthodontist. And also, I didn't write here you have a sleep apnea dentist. A sleep apnea dentist will be able to make an impression of your mouth, and if you need a dental appliance, so it can help you sleep but keep the airways open, so then that way you don't snore. So a sleep apnea dentist, it's also really important. So anyway, so that's it for now. So let's go back, and I'll see you on the other side. All right, guys. I really hope that the information that we went over was able to help you, because it's important that you know exactly the implications of mouth breathing, because it changed my life. Like I said before, I got really, really sick with these symptoms of high blood pressure, anxiety, and a rapid heart rate. And once I learned that mouth breathing was causing sleep apnea, and that it was within my sleep that I was getting sick because I was breathing through my mouth, and I remember doing this throughout the years. Once I learned and I started breathing through my nose, I'm telling you that I woke up the next day feeling much better. Now, I can't say that I went to 100%, but I felt much better, and I knew that was the problem. So it's important for you to figure these things out. Learn the implications of mouth breathing. Learn that it can get you sick, and you're gonna have to start breathing through your nose. And one advice that I give you, you definitely have to see a doctor if you're suffering from these things. You want to see an ENT doctor, because you want the doctor to see if you have any breathing obstructions when it comes to your nose and throat. I did that. I didn't have any breathing obstructions. I developed these things out of bad habit. Okay, so one thing what I do is when I sleep, right, I sleep on my side. I never sleep on my back flat with the pillow, because I'm going to open my mouth. Now I sleep on my side and I sleep elevated, at least using 3 pillows, right? And I position myself and I close my mouth. It takes a little bit of training, and I have some videos on that of how to train yourself to breathe through your nose and keep your mouth closed. But the first thing you need to know is that you have to be conscious about the situation. You want to be conscious, and you want to know that mouth breathing can get you sick, and you have to switch. Now, since sleeping and breathing is the most important thing to your health, wouldn't it make sense for you to find out exactly what's going on in your sleep? Because then you can make the necessary modifications. You can make the necessary adjustments. Because if you don't know what's going on with your sleep, if you think that you know, if you think that you're breathing accordingly, and you're still sick, then you're never going to get better. So you want to be able to rule that out. Now, one of the things that happened with me in the early stages, they sent me to a sleep study with a company called Home Sleep, and the company just sent me a device, and I just strapped the device into my chest, and I had some breathing apparatus that I hooked up to my nose. I turned it on, and what that does is it gives you sleep information. It lets you know if your oxygen levels drop, if your heart rate's increasing, if you're snoring, but most of all, if you stop breathing. And obviously I stopped breathing a couple of times. But the point that I'm trying to make, we have an explosion when it comes to wearable technology. We have so many digital care solutions at our disposal that there's no excuse as far as for us not to know what's going on with our body. And I'm going to show you this. So remember, I had a sleep study a long time ago, right? And what I have here is part of this company just sent me. I'm going to be making a review on this product, but this is a sleep study. Okay, now you hook yourself up, you hook the breathing apparatus in your nose, and you attach yourself to this little device that I have here, this small device, which is a fraction of the price of what these insurance companies be charging you. And you could find out exactly, professionally, what happens in your sleep or what's going on with your sleep. And then you could take this information to one of your doctors. And of course, if they want to send you to a sleep study, but at least you can have something like this, and you can make the necessary adjustment because you're finding out key information. Now, the best person that can take care of yourself is you. No doctor is going to be able to take care of yourself like you, but you need to have the right type of information. And once you have the right type of information, you need to have access to this technology. And in this channel, we're going to have access to a lot of different products, because if you can sleep accordingly, if you can breathe accordingly, that's going to be the foundation of health. And then we're going to tackle everything else. Another product that I'm going to introduce, right, is a smartwatch. We've seen how smartwatches have exploded when it comes to technology and when it comes to healthcare technology. But the problem is that sometimes these watches like Apple or Samsung, they could be a little bit pricey. And then the ones that are not as pricey, maybe they're like $200, $150, and some people don't want to pay that much money. Now, the watch that I have here right in front of me, right, looks just like an Apple Watch, and it's a fraction of the price. And I love this watch so much. I've been wearing it for weeks. As soon as I put it on, it gives me, I look at the interface, right, and I see my heart rate. Now, one thing that I want you to tell you guys, right, is that the heart is the second most important organ in your body. The brain is number one. You got to be able to take care of your heart. Taking care of your heart is not taking a physical once a year and finding out what's going on with your heart. Taking care of your heart is knowing how your heart is functioning all the time. Now, when you know when your heart rate is all the time, especially when you're stressed out, or when somebody gets you angry, or when you receive bad news, or when you're nice and relaxed, or when you're happy, when you know how your heart rate is all the time, then you can make the necessary adjustments. Let's just say if you receive bad news or you got really angry and your heart jumped over 100, 130 beats per minute, then you know why. Or maybe you got into an argument and your heart rate is increased drastically. Then you can make necessary adjustments. This watch gives you your heart rate. This watch gives you the steps that you walk throughout the entire day. By the way, I think today I already walked like 8,000 steps. Usually the average American takes 3,000 to 4,000 steps in a day. But you have this information in front of you, then you'll be like, you know what? 3,000 to 4,000 steps is not enough. You need to be walking at least 10,000 steps. So it gives you that information. It tells you your calories that you're burning. It gives you sleep information as well. It tells you your oxygen levels. It gives you so much digital information. I'm going to do a video on this. Another thing that this company has, right, that I've been using for a very long time is this little ring device here. This little ring device, it's mind-boggling amazing. Now, as soon as you put it on, right, it gives you your heart rate, which is important to know, especially if you don't have a watch. and it gives you your oxygen levels automatically. The objective of this device is for you to sleep with it. And when you wake up in the morning, you get a full report, and it lets you know exactly what was going on with your sleep. For instance, if you were snoring, then you know what? Why was I snoring all night? If your oxygen levels drop, why did my oxygen levels drop? And like I said before, low oxygen levels, if you don't have enough nitric oxide, you can really get sick. So the last thing you need is for you to be sleeping night after night and your oxygen levels are low. You can't have that. This device will definitely let you know. And then it tells you your heart rate. Sometimes when you're snoring and when you have insomnia, or you have low levels of sleep apnea. Remember, snoring means that you're struggling to breathe. So if you're struggling to breathe, what do you think? It's going to stress out the heart, and it's going to increase your heart rate. So if your heart rate when you're sleeping should be nice and calm, but if it's getting stressed out and it's accelerated, then you could be like, what's going on? Why is my heart rate increasing when I'm sleeping? So this is key information that these digital products that I have, they can tell you a lot as far as what's going on with your health. So there's no excuse, and there's more that we can discuss, but for now, this is the most important. Sleeping and breathing is the most important thing for your health. We need to know exactly what's going on with our sleep. With that being said, I'll see you guys in the next video. Bye-bye.